This is Jefferson Close-Up. I'm Carol Celine. My guest today is Dr. Scott Fisher. Welcome.
Thank you.
Now, you spent a lot of your high school years rowing, and then you kind of stopped, and now you're involved in a rowing endeavor called the Gold Cup.
Yes.
What is that?
Well, it's a very interesting event that was created around 1920 to honor Jack Kelly, Sr., winning the Olympics. The race was run for several decades and then stopped in the 1950s. The cup was lost. To make a long story short, it was found in an antique shop down in Antique Row in Philadelphia. Our committee acquired it about 10 months ago, and we've reinstated the race. So we've got these terrific international men and women athletes coming this weekend, as a matter of fact, to compete on the Schuylkill.
Oh, why, that is exciting.
It really is.
What are some words that would describe you?
Well, I'd say that I'm a consensus builder. The nature of what we do in medicine and radiation oncology requires a lot of consensus between radiation oncologists, medical oncologists, and surgeons, among others. So I try to work as a team member with our colleagues in other specialties. I'm also very focused and deliberate in what I do. I think attention to detail is critical in what we do, and I try to live by that rule.
Now, you see your patients at Aria Health in Frankfurt. What is your approach to patient care?
Well, I'd say holistic. We see the patients, myself and my colleagues. We like to design a very particular treatment plan for them based on their particular disease. It's very artistic, I'd say. You're sculpting fields with radiation therapy. And we take them through their course of treatment, and when they're finished, we like to follow them so we know what happened.
That's unusual in radiation oncology. I mean, after you've been treating them, you continue to see them and see them?
Yes, that's exactly right. Typically, we'll see them about a month after their treatment is finished, and then I'll see patients every 6 months for 2 years, and then annually thereafter, and obviously unless they have a new problem. And the reason we do that is that we want to make sure that A, their cancer hasn't come back, B, that they haven't developed another malignancy, and C, that we haven't developed any untoward side effects from what we've done.
Oh, well, that must be very comforting to your patients. Do you have like a standard piece of advice you give to people?
Well, after I see them in consultation, I tell them that you are going to have a lot of questions. This is a tremendous amount of information that's been thrown at you. You're going to leave my office and remember everything that you forgot to ask. So write it down on a piece of paper and give me a call at your convenience.
Oh, that's great. I hear so many people say, oh, I wish I had asked the doctor this or that.
All the time.
And it's nice that you acknowledge it. What would you like people watching this to most know about you and your practice?
Well, it's very personalized care. You know, if you come to see us, we take care of you. You're not being taken care of by residents, fellows, or other healthcare professionals. We take care of you. It's a team effort. There's lots of great healthcare professionals in our department, but at the end of the day, we're going to be there for you.
So it's an I'm there for you kind of practice.
Absolutely.
Lovely. Thanks for coming in.
My pleasure.